So how does President Trump's plan to reform health care compare with the Affordable Care Act currently in place, or at least the elements thereof? And what will it mean for consumers who are paying exorbitant health care premiums? Joining me now is Joel White, president of the Council for Affordable Health Coverage. Joel White, thanks so much for joining.
It's great to be here. Thanks for having me.
It's great to have you with us. Joel, the Affordable Care Act was designed to ultimately lower health care costs and coverage. Millions of Americans today are not feeling that. In fact, just the opposite. They're seeing their premiums skyrocketing. What happened?
Yeah, I think the Affordable Care Act is a poorly designed law that's driving up costs across the board, and consumers are paying the price. It's basically not working for working Americans, and premiums have tripled. Deductibles, the out-of-pocket costs people pay, have doubled, and it's increased 7 times faster than medical inflation. So there's a design flaw here in the law, and I think Republicans are looking at to try and fix to drive those premiums, those out-of-pocket costs back down.
Now, we saw healthcare was one of the main flashpoints during the shutdown, the historic shutdown that just fortunately ended for everybody right before the holidays. Do you think that the Democrats' proposal, which was to ultimately provide more or additional subsidies, would have actually helped to bring the cost of premiums down?
No, I mean, these were temporary subsidies. The Democrats wrote the law in 2022 during the COVID pandemic to be a temporary assistance to families. And those subsidies are expiring at the end of 2025 by design. That's how the authors of the law wrote it, to create that temporary assistance. What the problem was that in between 2022 and 2025, medical costs increased twice as fast. So the law is driving up these medical costs, and then we're trying to subsidize it to try and keep people harmless from those cost increases. It's not working. So what we need to do is actually go back, redesign the law, protect people from these premium increases and these out-of-pocket cost increases, but do it in a way where they continue to get access to quality, high-value insurance.
Why does it matter, and what are the drawbacks?
It matters quite a bit. I mean, we're all at one point going to be patients. We'll all access the medical system, and so we all want to protect ourselves and our families from a catastrophic event, from an accident, from a sports injury, or from cancer or other kind of disease. And so we want that care to be available to us when we need it. And what we're seeing in Obamacare is these plans severely restrict access to doctors and drugs. They're the most restrictive plans on the market. And so we're subsidizing a very expensive product, but actually a product that's pretty low value, because we actually, at the end of the day, have a lot of difficulties going to see doctors and get the drugs that we need to actually get healthy. So that is a huge problem, and a thing that I think the president is trying to reform by empowering consumers, getting the money back into their hands so that they can choose any plan on the market that would cover pre-existing conditions, that would be available to those consumers, but to purchase lower cost plans. That competition in the marketplace should help drive premiums down for everyone.
Now, the Affordable Care Act, otherwise known as Obamacare, this has been a real thorn in the side of Republicans, particularly President Trump. When you look back at his first term, John McCain, that one vote away from really being able to repeal it. But yet here we are. What are some of the real, practical solutions to repeal Obamacare?
I don't think we're talking about repeal. We're talking about reform. And I think in the first Trump administration, that was the big problem. We were talking about repealing a law that governs the individual market. We'll always have an individual market. There will always be people who maybe lose their job-based coverage and need a temporary individual market policy. There's self-employed people, the entrepreneurs that are running their own businesses, that will always need an individual market policy. So we want to have rules that apply to those policies that allow consumers to access the insurance they need, to access the care they need to stay healthy. The challenge with Obamacare is it made everything more expensive. It just said the most expensive plan, and we'll only subsidize that plan. So we got more expensive care as a result. What I think is some of the simple solutions, the first thing the president put on the table, which I think is really smart, is let's give the money to consumers, not to big companies, big insurance companies. So the consumer gets the money, the consumer gets to pick the plan. Some of these plans on the market are 7 times less expensive than Obamacare. They cover your doctors, they cover your drugs, they cover your hospital stays. So opening up that market, expanding competition, giving folks money that they control as in a health savings account or another type of account is really smart, because it'll drive those premiums way down.
How big of an opportunity is this?
The hope is this could fundamentally transform our thinking about healthcare in general. For a long time, we have spent a lot of money in Washington, D.C. We've put rules on that spending, and we've basically told doctors, nurses, pharmacies, pharmacists, hospitals, insurance companies, here are the rules you have to play by. And over time, as that money increased, the rules increased, the requirements on those doctors increased, and it disintermediated the consumer. It put the consumer on the sideline and said, I'm just a pawn in this system. I don't really count because I'm not controlling any of the money and I'm not making any of the rules. So this is a paradigm shift where we're giving consumers money, resources, and the ability to choose based on what's available in the market. That flips the dynamic. That means the hospital, the doctor, the insurance company has to be responsive to me because I'm controlling the money. So it is a completely different paradigm shift. Hopefully that bleeds out into the larger employer market, into Medicare and Medicaid ultimately, so that consumers ultimately are driving the car, not the big companies and the federal government.
Joel White, really appreciate your perspective. Thank you so much.
Thanks for having me.